the capping of payments for home oxygen equipment after 36 months, the mandatory requirement during this period of no payment to maintain service to patients even when they move out of state, and the minimal monthly payment of $77.45 for portable oxygen refills runs the gamut from being untenable to patient risk and counterintuitive to reducing healthcare expenditures. But don't take my word for it. Today in Rochester, New York, with Phyllis Wilson and her son Doug. And what we'd like to talk about is the changes in oxygen and how it's affected their lives. How long has your mom been on oxygen?
Probably about, what is it, about 4 years, 5 years? Something in that neighborhood.
Well, quite a while then.
Yeah, quite a while.
You have a nice apartment here, and I see you have the machine that makes the oxygen. And so you use the oxygen how often? All the time, or?
All the time. All the time. When she's not in the apartment, we use the portable tanks in her wheelchair, and then she's able to go to dinner or to activities, bingo, or what have you.
If she didn't have the portable tanks, then she couldn't go down to the dining room. That's what you're saying.
In effect, it would mean she couldn't be here, because that's part of being able to live here, is that you have to be able to do at least that minimal level of involvement.
So when did you find out about the changes in the oxygen?
It was a complete surprise in January that we were advised that we would be paying for oxygen that had previously just not been a problem.
Since Medicare has capped the oxygen after 36 months, and now they pay such a small amount for the reimbursement for tanks, someone that needs quite a few tanks every week, it puts them in a difficult position as far as out-of-pocket expense.
It's very difficult, and maybe just to put it into context, up until now, the oxygen that we received, we worked with Upstate for years. We just didn't have to think about it. We would just call, if we needed tanks, we called in, we got tanks. If we needed tubing, we got tubing. And it was all at a fixed monthly cost. And with this change in January, which just took us totally by surprise, she uses I think it's between 15 and 20 tanks a month.
That's a lot.
And so our cost has gone from $10 a month to $15 per tank. And if it is 20 tanks a month, that's what, $300, right?
And all Medicare is going to pay back is
$70-some.
Right.
So it's another problem that we had to face and try and deal with. And quite frankly, I don't know what Mom would have done if she hadn't had kids around to try and
help her out. Right.
I literally don't know what she would have done. So that's our situation.
So that's your story.
Say what you need to say. Say what you need to say. Say what you need.
So how long, Frank, have you been on oxygen?
Well, good 8-9 years.
And your wife also has oxygen?
Yeah, she's been at it about, I want to say 5 years, somewhere's in there.
You use it all the time, or can you take it off?
24 hours a day.
You heard about the changes in the oxygen reimbursement starting in January.
Yes, I did.
There's changes in the way they pay for it, and now, because they pay so little for the oxygen tanks, some home care companies are requiring patients to pay for them up front. How does that affect you and your wife?
Can't do it. Our medication right now is so high between my wife and I, and for me to pay it, it's impossible. You just can't do it. It would have to cost me and my wife about $150 a week, $75 a piece.
Wow.
After we use the 5 times 4, that's $600. That's almost $7,000 a year. Where am I going with that?
Why do you need the portable tanks? Where do you go to use those?
I go to the doctors. My wife, she sees 4 doctors. So between that, blood tests, going to the hospital all the time, going shopping, picking up my medication, or whatever other things that we have to do, we just can't do it with the tanks.
After you've used up the tanks that you have, then you're pretty much stuck in the house.
We're like a prisoner. We can't go nowhere. It's impossible. If it was an emergency, we can't go nowhere.
How do you feel about the fact that the government's changed the rules?
I tell you, here's what I feel. I pay taxes all my life. You take me and throw it out? And be truthful with you? And I'm gonna say this, and I hope Washington hears it. You read the paper about these countries that eliminate people, what do you call it, genocize?
Yeah, genocide.
Well, that's what they're doing here with the old. They don't want you no more. They want to just dump you because they want what this, there's Medicare and Medicaid.
Mm-hmm.
They want to save money, whatever they're going to do. It just, in my ways of thinking, they want to get rid of all the old people. And you can't tell me no difference. You have to fight for your medication. You go to get medication and it's sky high. I mean, I went to get 20 pills for antibiotic. $216 for 20 pills for antibiotic.
Wow.
You probably could go to Mexico or Canada and buy them for 20. But that's what's happening. You fight every day. And I'm ready to give it up. Be truthful with you. I'm 77, I don't care anymore. My wife feels the same way.
Well, we're going to take your story to D.C. with us, and we hope that people will pay attention and they'll listen to your story.
Well, if they got a little brains and a little heart, tell them to start doing something. And not for anything. They're out to help everybody, but they know how to spend billions overseas. But they sure don't know how to spend it here. You know what I'm talking about?
Yeah.
Mm-hmm. Well, give me $1. You know, I used to eat steak. Now I'm on bread and water.
Well, thank you, Frank.
You're welcome.
For talking with us.
You're
Okay?
welcome.
Say what you need to say. Say what you need to say. Say what you need to say.
I gotta know what you want me to say, what you don't want me to say, because,
You say whatever you want to say.
yeah, but you're gonna ask me questions on it,
Mhm.
okay.
You just say what you want to say. I'm here today with Ken Root, and we're in basically the area of Utica, New York. And we're here to talk a little bit about the oxygen changes and how they affect him, and we're trying to get his story. Ken, you've been on oxygen for about how long?
Well, guys, about 4 years now, 4 or 5 years.
How often do you have to
Well,
use
I
it?
progressively started using it more the last few months. I actually got to use oxygen wherever I go now because just a simple walk from here to my vehicle outside sends my oxygen level way down to where I can't walk. In fact, I'm out of breath. So I got to wear an oxygen tank whenever I go to doctor's appointments, to the post office, to the bank, wherever I go. It's a medical necessity. It's not a comfortable thing. It's a medical necessity.
You've been informed about the different changes that have happened with Medicare that started in January, on how they're stopped paying for the concentrate after 36 months, and the amount they pay for tanks for a month is a very small amount. A lot of companies aren't accepting that and they're requiring people to pay for the tank up front. How is that change affecting you?
It affects me because it's a medical necessity thing for me, the oxygen. On a fixed income, it becomes rather hard because the amount of oxygen I'm taking here, tanks a week, you're roughly talking about $120 to $150 a week. That's $600 a month. That's very high on somebody like me that's on a fixed income. I'm just not happy with the way they're handling things here for the elderly, senior citizens, and us who are disabled and not out of work now. When we need it the most, they're not there.
Weren't able to buy tanks, to pay for these tanks.
I don't know.
I mean, what would happen to your quality of life as far as what you could do and what you
I'd
couldn't
be in
do?
a hospital. I'd be in a hospital. In fact, in the long run, it's going to cost them even more by not taking that preventative care for me because I'm ending up in a hospital because I ain't going to be able to live out here.
What would you like them to do about this oxygen situation? If you could get them to change it some way, what would you want them to do?
Just to have things back the way they were before.
Well, Ken, we really appreciate you letting us come into your home and telling us your story so that we can take that with us. Well, it's important to get your message to them, to actually talk
Well,
to
I hope
people
they
that use
listen.
it.
I just hope they listen.
Well, we'll see.
Thank you for coming in and asking my opinion.
Thanks.
Say what you need to say. Say what you need to. Say what you need